The next item of business is a statement by Neil Gray on health and social care response to winter. The Cabinet Secretary will take questions at the end of his statement, and so there should be no interventions or interruptions. And I call on the Cabinet Secretary up to 10 minutes, please.
Thank you, Presiding Officer. I'd like to thank you for this opportunity to update the Scottish Parliament on how our health and social care system is responding to the pressures of winter. It is clear our health and social care services and the people they serve are experiencing the impact of peak winter demand. It's traditionally a challenging period of the year, and this year has been no different. In particular, the NHS continues to see significant numbers of cases of influenza A, which have been and remain very high. This extraordinary flu surge, of course, adds to the normal respiratory issues we might expect at this time of year. In the face of this particular issue and the wider winter pressures, I would first like to express how enormously grateful I am sure everyone in this chamber is to all those working in our health and social care settings for their immense efforts over the busy festive period. The resilience and determination shown by staff in the face of pressures across the health and care sector is inspiring. There is so much to thank them for. Every part of our health service has gone above and beyond to serve the country during the hardest months of the year. I thank the ambulance service staff for their sacrifice and devotion to their task by staying at work beyond the end of their shift as they wait to turn around at hospitals. I thank the social care staff doing extra shifts to make up for staff being off sick with flu. GPs working at the weekends to offer appointments and bolster the resilience of the entire system. Hospital staff, like the porter I met at St John's in Livingston on Christmas Eve, working so hard to turn around beds as quickly as possible. We in this chamber often talk about service, but this is the reality of public service. The hard work, relentless work, skilled, devoted, dedicated work to serve the people that need it most. Presiding Officer, we owe all of them a debt of gratitude. With the First Minister in recent days and weeks, I have been meeting with health boards, representatives from the Scottish Ambulance Service, Health and Social Care Partnerships, Public Health Scotland and NHS 24. We have discussed the latest system updates, the high cases of influenza and how the health service is responding to increased demand. I'm very encouraged to hear about the collaborative working right across the system with strong leadership and staff supporting one another. In practice, this cooperation has seen boards working closely with the Scottish Ambulance Service to manage the flow of patients through emergency departments across Scotland. The Scottish Ambulance Service and board senior clinical managers have been present on hospital sites, assessing risk and prioritising patients most in need of urgent treatment. GPs from out-of-hours services have been working in minor injuries departments and helping to treat and discharge patients where clinically appropriate. The Scottish Ambulance Service Integrated Clinical Hub, which receives calls transferred from NHS 24, has calls reviewed by GPs in the call centre. They help to advise self-care, prescribe medication or refer to out-of-hours services when it is clinically appropriate to do so. This helps more patients to be treated at home or in the community and prevent unnecessary ambulance conveyance to hospital. It is this kind of coordination that has helped play an important role in protecting resources for those most urgently in need. I would also want to express my regret that anyone seeking care has to wait longer than necessary to receive it, and I have no doubt that this has happened over this difficult period. But at this point, thanks to the robust preparation and the dedication and hard work of staff across the health service and social care, our services to continue to hold up well in the face of these additional pressures. This has been so important because there is no doubt Scotland has been hit hard by flu this winter. Whilst we did plan for seeing increases in flu over the winter, the very high levels we are experiencing puts inevitable strain on the system. The latest data from Public Health Scotland shows that the incidence of influenza in the community in Scotland has continued to increase in the latest week, although the rate of increase appears to have slowed. We have seen the impact of flu in our hospitals, where we have seen over 1,500 influenza-related hospital admissions in the latest week, surpassing the peak of around 1,400 in the winter of 2022-23. Presiding Officer, every year the demands of winter challenges our health systems. That is why, in preparation, we published our winter plan a month ahead of last year and earlier than ever before, to allow more time for whole system preparedness. Published on the 24th of September, the Winter Plan was developed with input from the whole health and social care system in partnership with COSLA, bringing together best practice and improvement work to ensure that the most appropriate care is received in the right place and at the right time. Our investment in Hospital at Home has paid dividends, enabling patients to spend this Christmas in their homes with their families where this is clinically appropriate. This vital service reduces hospital occupancy whilst providing high-quality care. As part of the Winter Plan, we committed to providing additional staffing within NHS 24 to support demand over the winter period. This recruitment has been a success, with call handlers now at full establishment and additional clinical staffing in post. Health boards have ensured the provision of NHS pharmaceutical services so that people continue to have access to prescribed medicines and services such as NHS Pharmacy First and a range of public health services. Our NHS Pharmacy First Scotland service is also available in all community pharmacies to anyone registered with a GP practice in Scotland. It allows members of the public access to expert healthcare professionals without the need for an appointment. And in these winter planning efforts, we have learned from previous intense winter pressures, and we have built on our approach to out-of-hour services, escalation and board delivery support on this experience. Because of this, out-of-hour services have remained resilient and responsive thanks to continued investment in the service and rigorous planning of staffing cover for winter. The flu vaccination programme runs until the end of March, while the COVID vaccination programme runs until the end of January. And as of the 15th of December, we've administered over 1.2 million adult flu vaccinations. The Scottish Ambulance Service has been instrumental in working collaboratively with boards over the course of the winter vaccination programme. Their mobile vaccination outreach service has provided accessible vaccination to remote, rural and island communities. Vaccination offers the best protection against serious illness from flu, so I urge those who are eligible for vaccinations this winter to please come forward as soon as possible to protect themselves and support health and social care services. Beyond vaccination, Presiding Officer, everyone can also reduce the chance of catching flu or spreading it to others with good hand hygiene and other precautions, and by staying home if you have respiratory symptoms. I've thanked the workforces of our health and social care services and will continue to do so. But I also really want to use this opportunity to thank the Scottish public too for taking heed of messages about accessing the right care in the right place and taking the steps to slow the spread of infections. As I've stated throughout recent weeks, it is very important for everyone to be familiar with the different resources available, including through NHS Inform's online tools that can help you get appropriate health advice as quickly as possible. People should always call 999 in a life-threatening emergency, but if this is not the case, please visit nhsinform.scot or call NHS 24 on 111 first. I must thank those people who are looking after or even just looking out for other people. Those who have checked in on elderly relations or friends, those who have helped with the messages and provided other support over this time, the hardest time of the year, I am grateful. And I would also like to recognise the role of unpaid carers, the length and breadth of Scotland who work year-round supporting their loved ones. They are often overlooked, the overlooked heroes of our health and social care system. I thank them also. We also want to reiterate this Government's commitment to supporting general practice during this critical time. On the 29th of November, I announced an additional £13.6 million investment in general practice for this financial year. This funding is aimed at addressing financial pressures, supporting staff costs and enabling practices to recruit and retain staff. It's a practical response to the challenges GPs face, especially during this period of high demand. Our dedicated social care and social workforce have worked tirelessly throughout the festive period, supporting people to remain well and live independently in their communities. This proactive support reinforces our health service by preventing the need for hospital admissions at a difficult time, whilst ensuring that individuals are cared for in the most appropriate setting. Care homes have, of course, been affected by flu and, in some cases, have been required to close in line with infection control procedures. We have engaged with local systems to make sure they have the latest guidance and support on infection control, and I know that they are working collaboratively to manage that pressure. And as with previous years, there has been significant work to reduce the level of delayed discharge across the system in advance of Christmas. Health and social care partnerships have been working hard to try to make sure that as many people as possible who are clinically ready to leave hospital can do that, whether they are returning home or to a care home. This includes maximising the use of discharge to assess, hospital at home and other initiatives that help make sure people can get the right care in the right place. To conclude, Presiding Officer, winter tests every one of us. It tests individual people and families and our healthcare systems. But this year, thanks to the incredible efforts of NHS staff and sure-handed planning, we are facing it with resilience and resolve. And I'm sure the whole Chamber will join me in supporting once again thanking the staff of our NHS and social care services who provide so much to this nation in these difficult and challenging times.
Thank you. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow around 20 minutes for questions, after which we'll move on to the next item of business. And I'd be grateful if members who wish to put a question were to press their request to speak buttons. And I call Sandesh Gulhani.
Thank you. And a declaration of interest as a practising NHS GP who was working over the Christmas period. I would like to start by thanking all staff who provided care for us during the Christmas period. Seems people don't like the fact that I was working over the Christmas period, Presiding Officer.
Please carry on. Let's hear Dr Gulhani.
Flu is not simply a cold. Flu is a serious and potentially fatal illness. And if you are in a high-risk group, I would urge you to go and get your vaccination. The Cabinet Secretary has boasted of the number of vaccinations delivered, but this actually represents a 25% reduction in vaccinations delivered compared to last year. Now, I've been telling the Cabinet Secretary that his winter plan was not worth the paper it was written on, and this was shown with November's A&E waiting times being the worst on record since 2007, when the SNP came to power. I have two questions, Cabinet Secretary. The Cabinet Secretary said that recruitment for NHS 24 has been a success, but some desperate people calling NHS 24 had to wait over 4 hours, and over 100,000 calls were abandoned due to waiting too long. What is the Cabinet Secretary doing to ensure that 111 has the capacity to deliver? And over the past decade, there's been an almost 10% decrease in the number of rural GP practices, despite the Cabinet Secretary claiming today they are providing accessible treatment for remote, rural and island communities. What assurances can he provide today to rural patients and my rural GP colleagues that these are not just empty words?
Cabinet Secretary.
Thank you, Presiding Officer. I thank Sandesh Gulhani for his contribution and indeed his service, and all those GPs and other health and social care staff who contributed to responding to the health and social care pressures that were being faced over Christmas. I recognised in my statement that we have seen general practitioners opening their surgeries at weekends in order to provide support to the whole system, and that, alongside Dr Gulhani's service, has helped to make sure that the resilience has been there both in hours and out of hours. And I also referenced the work that general practitioners have been doing in supporting the Scottish Ambulance Service and NHS 24, as well as flow navigation services. So these are our general practitioners, I've said before, I say it again, are integral to our health and social care system, and I'm very grateful to all those who have worked over the Christmas period to respond to the pressures that we have seen. Dr Gulhani was right to recognise the severity of flu, the impact that that has had on our system. It is clear and it is real. That has been seen by me in terms of the visits that I took part in just before Christmas, and indeed the First Minister has carried out over the weekend. And in terms of the winter plan, I've already pointed to so many of the successful elements of the winter plan that have been delivered thanks to the incredible work of our health and social care providers, such as the expansion of hospital at home, such as the work to ensure that flow navigation centres were providing virtual access to accident emergency services. There is a range of areas within which our winter plan has worked and has ensured that we've been able to respond to what I believe to be unprecedented levels of flu in recent years impacting upon our systems. In terms of NHS 24, the statistics that he quotes around those choosing to relinquish their call. Obviously, there is a callback service that is in place that will have contributed to some of those people choosing to hang up. But I recognise that for some people they will have had to wait too long, and I apologise for that. But the investment that has been made in NHS 24 to ensure that there was an additional level of staffing available that I was able to see, the First Minister was able to see prior to Christmas, meant that they were able to respond well to an increased level of demand that there has been over the festive period. And I'm very grateful to everybody for the work that they have carried out over this difficult, challenging period.
Jackie Baillie.
Let me start by thanking all health and social care staff, including those working in the third and independent sector as well, for their valiant efforts over Christmas and New Year, despite the lack of vision and support from the SNP government. When the Cabinet Secretary announced his winter plan, there was not a penny extra for delayed discharge. The latest data from October has a record high of 2,000 people stuck in hospital. And whilst I welcome announcements about hospital at home, they relate to the next financial year and will be cold comfort to those waiting to get home now. It's early for a statement on winter pressures, but perhaps the Cabinet Secretary is trying to get ahead of statistics on delayed discharge next week. So can he tell us what is the level of delayed discharge today and whether it's gone up or down on his watch? Turning quickly to the ambulance service, winter has barely begun and we're seeing real pressure on the system, with ambulances routinely queuing up outside hospitals and a level 4 emergency declared. Can the Cabinet Secretary tell us what he's done to address this over and above the winter plan to support our hard-working paramedics?
Cabinet Secretary.
Thank you. I'm very grateful to Jackie Baillie for referencing, in addition to those that we've already spoken about, the community and voluntary sector staff that contributes so much to our health and social care services, providing access to and reaching people that statutory services can't. So I recognise and thank Jackie Baillie for referencing them. Hospital at Home is operating now and has been increased in this financial year. It is something that is an innovation that is right for patients. It allows people to remain in their homes. It's right for our health and social care services. And should our budget pass, it means that by the end of the next financial year, we will see hospital at home beds expanded to become the largest hospital in Scotland, because it is innovation that works. Delayed discharge figures are going to be published tomorrow, and she'll understand why I cannot preempt what is to be within them. In terms of the ambulance service, she's absolutely right that our ambulance service has faced unprecedented demands upon its services. For Jackie Baillie's argument to hold water, though, she has to pretend that ambulance services elsewhere in the UK have also not faced unprecedented challenges. The critical incident that was announced in Wales and various hospital trusts elsewhere in England point to this being a shared challenge that has been faced because of flu this year. And I was incredibly heartened by the conversation that I was able to have with Wes Streeting and other health ministers across the four nations just before Christmas around what we need to do around reform and improvement, because I believe that there are shared areas we are looking to invest in, which is around shifting the balance of care, around reducing hospital occupancy, reducing the length of stay within hospitals, and reducing delayed discharge, because it is that is causing the choking of our systems, that are meaning that our ambulance service staff, for whom I'm very grateful for, are struggling to be able to convey patients into hospitals. So I'm not absolving responsibility of the situation that's been faced here. What I'm trying to point out is the context to Ms Baillie, which I know she will be aware of, as others across the country are as well.
Thank you. I'm very keen to enable as many members as possible to put questions, and concise questions and responses are required. And I call Fulton McGregor to be followed by Brian Whittle.
Thank you, Presiding Officer. Yesterday I met with GPs and the practice manager at the Atrium Medical Centre in Coatbridge. I was given a demonstration of a typical day at this busy GP practice and heard about the pressures being faced all year, and particularly during these difficult winter months. So can I therefore ask the Cabinet Secretary what support there is for GPs in their role in response to winter pressures, and what opportunities there are for GPs to feed their concerns into government moving forward?
Cabinet Secretary.
Thank you, President Officer. I thank Fulton McGregor for his engagement with general practice within his constituency. I'm very heartened to hear that engagement is happening. I also want to reiterate this government's commitment to supporting general practice during this critical time. I referenced in answer to Sanders Colhany the areas that I have seen incredible work by general practitioners over the festive period, and for that I am very grateful. In addition, on the 29th of November, I announced at the BMA's Scottish Local Medical Committee Conference an additional £13.6 million investment in general practice for this financial year. This funding is aimed at addressing financial pressures, supporting staff costs, enabling practices to recruit and retain key staff, and it is a practical response to the challenges that GPs are facing. I frequently meet with the BMA and my officials have regular meetings with the Scottish GP Committee as well, providing opportunities for GPs to not only raise their concerns but also discuss the opportunities that reform and improvement and shifting the balance of care from secondary into primary has as an opportunity going forward.
Brian Whittle, to be followed by Audrey Nicholl.
Thank you, Presiding Officer. The Cabinet Secretary talked about ensuring as many people as possible who are clinically ready to leave hospital can do that, whether they are returning home or to a care home. But, Presiding Officer, we know that care home places have been cut by a fifth, especially felt in rural areas, at the same time as so many cottage hospitals have been closed. So, Cabinet Secretary, is it little wonder that there is such a strain on hospital admissions with step-down care reduced by so much, with that direct impact on delayed discharge?
Cabinet Secretary.
One of the key areas for the budget that has been proposed for the next financial year is the £100 million of reform and improvement, which is to support the shifting of the balance of care from secondary into primary, but also to provide greater capacity within social care. Because I accept the premise that has been put forward by Brian Whittle, that we need to make sure that there is capacity in all aspects of our service to relieve the pressure that is currently being faced. And I narrated in response to Jackie Bailey the central pressure that has been faced by our ambulance service colleagues has been the inability to convey patients from the ambulance into accident emergency, because our accident emergency staff are unable to move patients from the ED departments into the hospital because patients are not moving on. That is why I encourage MSP colleagues to support the budget, so that we can continue to see that investment happen into social care, so that the capacity is there to meet the demands that there are from patients across Scotland.
Audrey Nicholl, to be followed by Paul Sweeney.
Thank you, Presiding Officer. At the end of last year, constituents of mine and of colleagues across this chamber saw first-hand the pressures on A&Es and hospital capacities as NHS Grampian declared a critical incident. So can the Cabinet Secretary outline the steps being taken by the Scottish Government to ensure that, should this occur again in any area of Scotland, that staff and members of the public alike are prepared and, importantly, informed of the best course of action to take to access the care they need?
Cabinet Secretary.
Yes, and I'm very grateful to Audrey Nicholl for raising this point. The First Minister has chaired meetings with all those representatives that I set out in my statement in order to coordinate and ensure that there was a confidence about the resilience of the system to avoid the situation that Audrey Nicholl has outlined as happened in NHS Grampian. In practice, there has been incredibly strong cooperation between both national and regional boards, working closely with the ambulance service to manage the flow of patients through emergency departments across Scotland. The GPs from out-of-hours services have been working in minor injuries departments to help treat and discharge patients. The Scottish Ambulance Services Integrated Clinical Hub, which receives calls transferred from NHS 24, has been reviewed, has had calls reviewed by GPs in the call centre, so to help advise self-care, prescribe medication or to refer to out of hours. And with regards to critical incidents, health boards operate their own escalation policy for the management of inpatient capacity, and that includes well-established processes with locally agreed trigger points for maintaining a safe service and ensuring patient safety. And actions are widely communicated with staff to ensure they know the appropriate course of action to respond to pressures, and boards can, of course, ask Government for advice as and when it is required.
Paul Sweeney, to be followed by Stuart McMillan.
Thank you, Presiding Officer. The Cabinet Secretary said that services are holding up well over this winter, but those words are of little reassurance to many staff and patients, such as my constituent who is in his 80s and had an emergency urology problem on New Year's Day, but was told there were no urology services available all at the Queen Elizabeth University Hospital and at least the following week. After phoning around, he was advised to attend Glasgow Royal Infirmary's A&E department, but there were no ambulances available for 6 hours, so he had to take a taxi. He was admitted and they phoned to call in an emergency urologist, but this was after hours of agonising pain, confusion and frustration for my constituent. So what assurance can the Cabinet Secretary offer to elderly constituents like mine who are understandably frustrated about the lack of provision of specialist services over the Christmas period when many are at their most vulnerable?
Cabinet Secretary.
Thank you, Presiding Officer. I thank Paul Sweeney for raising the case of his 80-year-old constituent. I apologise for the situation that he's faced. I recognised in my statement the fact that there will have been too many people who will have waited for too long over the festive period. The prioritisation and escalation through the winter plan is the point I was referencing as allowing the system to hold up well in the face of what I believe to be unprecedented levels of flu within the system over compared to recent years. But I recognise that there will have been too many people waiting for too long. I'd be more than happy to receive more information about the situation that Mr Sweeney's constituent faced and ask for more information from Greater Glasgow and Clyde Health Board so that he can have full information as to what happened in that situation.
McMillan, to be followed by Gillian Mackay.
Thank you, Presiding Officer. I understand that a record number of NHS 24 call handlers will support the public to access the most appropriate care this winter as services deal with increased demand. Can the Cabinet Secretary highlight how effective this has been so far this winter and how the Scottish Government will continue to support this service to ensure that patients receive the right care in the right place at the right time?
Cabinet Secretary.
Thank you, President Officer. And I thank Stuart McMillan for raising this point. As part of the winter plan, we committed to providing additional staffing within NHS 24 to support demand over the winter period. This recruitment has been successful, with call handlers now at full establishment and additional clinical staffing in post. A record number of NHS 24 call handlers have been available this winter to direct people to the most appropriate care, helping reduce unnecessary accident emergency attendances. As at the September 2024, NHS 24 had a total of 1,492.3 whole-time equivalent staff in post. Over the last 10 years, the number of staff in post in NHS 24 has increased by 54.5%. In addition to the direct service that's provided by NHS 24, I was able to hear in the most recent visit to NHS 24 before Christmas the work that is provided from there by the Breathing Space team to support people who find the festive period incredibly challenging from a mental health perspective. And so I'm grateful to all those who have been working across NHS 24 for the work that they have done under considerable pressure from demand across the system.
Gillian Mackay, to be followed by Alex Cole-Hamilton.
Thanks, Presiding Officer. In the last few weeks, winter pressures have meant that we've had several warnings from health boards not to come to A&E unless it's an emergency. For many, minor injury units as an alternative are not as close as their local A&E, and this includes my constituents in Falkirk, where the nearest minor injuries is Stirling. For some, that means passing 2 hospitals, including the A&E, to go to minor injuries, and for many, this just isn't an option. Has the Cabinet Secretary assessed what benefit there may be in opening a minor injuries unit in Falkirk to help relieve pressure, especially during the winter months?
Cabinet Secretary.
I thank Gillian Mackay for raising this point. I would reiterate the point that I made in my statement around ensuring that people are accessing the right care in the right place, utilising the services that are available through NHS Inform as well as NHS 24. I hear the point that she's made around minor injuries units. That's obviously a decision to be taken by the Forth Valley Health Board, and it's something that I'd be more than happy to facilitate a discussion for Gillian Mackay to have with them around that potential facilitation.
Alex Cole-Hamilton, to be followed by Claire Haughey.
Thanks very much indeed, Presiding Officer. Can I echo the words of the Cabinet Secretary and give thanks to all those who worked over the festive period? This morning, Presiding Officer, we learned that only 58.4% of people who attended A&E in the last week of December were seen within the 4-hour waiting time target. More than 3,000 people waited over 8 hours. That isn't just intolerable for the patients and the staff in our emergency care departments, but it's causing ambulances to stack up outside, unable to discharge their patients, and causing causing delays to getting emergency care to people who need it urgently in our communities. People are dying as a result of this, and I wonder if the Cabinet Secretary will finally instruct an inquiry into deaths caused by the emergency care crisis.
Cabinet Secretary.
So I recognise the challenge that there is within the system. I've narrated that in response to Jackie Bailey as well as to Sandish Kulhani and others, that we need to come forward with the investment that comes through the budget, the proposed budget, that allows for greater capacity to be afforded within social care, within primary care, to avoid people being admitted to hospital in the first place, and to provide the capacity that allows for our accident emergency departments to be able to deal with patients, as well as our ambulance service to be able to convey patients. That is an issue of hospital occupancy, it's an issue of length of stay, it is an issue of delayed discharge, and it's an area that we have prioritised spending within the budget to allow that to happen, and I look forward to MSPs across the chamber supporting that to allow us to ensure that we can provide a situation that allows the improvement of our services, because I agree with Alex Cole-Hamilton. The situation with regards to our 4-hour standard is not good enough. It's not one that I accept. It's one that we need to see improving. That happens by creating capacity, and that comes through the investment from the budget.
Claire Haughey, to be followed by Annie Wells.
Thank you, Presiding Officer. And I remind Chamber I'm employed as a bank nurse by Greater Glasgow and Clyde NHS. I recognise that there has been increased concern, not just in Scotland, but across the UK regarding the high level of flu infections in all age groups this winter. Can the Cabinet Secretary outline what work has been done to encourage uptake of the flu vaccination and what the current rate of uptake is?
Cabinet Secretary.
Thank you, President Officer, and I thank Claire Haughey for highlighting a critical area that I would again encourage people, anybody that is eligible for a flu vaccination or a part of any of the vaccination programmes this winter to take the opportunity up. As of the 15th of December, we've administered over 1.2 million adult flu vaccinations and over 517,000 child flu vaccinations. Uptake in the highest risk groups, such as those living in care homes and those aged 75 and over, remains strong, although slightly lower than what we achieved in the winter 2023, with 82% of care home residents and 78% of those aged 75 or over having been vaccinated against flu this winter. Health boards have been heavily advertising their drop-in clinics, with many citizens accessing vaccination over Christmas and New Year, so we do expect these figures to increase when the next round of data is published by Public Health Scotland later this week. And a range of tailored resources and promotional materials have been prepared by PHS and disseminated through partners, including local NHS boards, the community and voluntary sectors, as well as government, to encourage uptakes for all of those eligible.
Annie Wells, to be followed by Emma Harper.
Thank you, Presiding Officer. What is the Cabinet Secretary's assessment of the availability of flu vaccine and appointments for those under 65 and not within the at-risk group who want to get a vaccine but simply have been unable to do so?
Cabinet Secretary.
So we've been working with all health boards to ensure that they are providing ready access to people who are eligible to receive a vaccine, and to ensure that barriers are removed to people being able to receive a vaccine. I was heartened to hear many health boards seeking to bring vaccination clinics to staff, for instance, to increase staff access to vaccination. And if there are specific examples that Annie Wells has where that has been an issue, then I'd be more than happy to hear it and raise it either with Greater Glasgow and Clyde or indeed any other health board where that is perceived to be an issue.
And Emma Harper.
Thank you, Presiding Officer. We know that one of the best ways to reduce the risk of flu and other viruses is for people to take steps to protect themselves, and the Cabinet Secretary has mentioned uptake of vaccines already. And I remind Chamber that my previous role was as a clinical educator in NHS Dumfries and Galloway. Can the Cabinet Secretary advise on what further public health messaging the Scottish Government will utilise to re-emphasise how people can keep themselves safe from flu and other viruses? I'm thinking about infection control and prevention measures as well.
Cabinet Secretary.
I refer again, Emma Harper and colleagues, to the work that's been provided by Public Health Scotland as well as by government around right care, right place, but also the messaging that is so important around making sure people utilise the opportunity to get hold of a vaccination. It is the right thing to do for you yourself in terms of avoiding critical illness. We were hearing from Sandish Kulhani how serious influenza is, but also how important it is for our health and social care services. The social care services in particular have been impacted by staff absence because of flu, and that is part of the reason why I would encourage anyone who has an eligibility for vaccination to take every step possible to ensure that they are utilising that opportunity before the 31st of March.
Thank you. That concludes the ministerial statement. There will be a moment or two to allow front benches to organise themselves for the next item of business.